Today we want to talk about arthritis. It's very crippling, very painful when you have it, and if we can give any relief to those patients with it, this is a big plus for someone's health. Today we're going to talk about acupuncture, osteopathic manipulative medicine, and homeopathy in the treatment of arthritis. Let's go to the table and see how we begin to do that. In this case, we're going to treat the knee today. We want to exemplify the various meridians that run through this area and relate them back to the organ systems. The spleen acupuncture meridian passes up this way. This is one point that we'll use. There is a liver acupuncture point here, and there are gallbladder points here, and there are some stomach points here. You begin to realize that if something is wrong in an organ system, such as the spleen, which in Chinese medicine is called the spleen, but we call the pancreas in Western medicine, something related to blood sugar metabolism, or the gallbladder right here, which is related to fat metabolism in the body, or the liver up here. This is called liver 8, the water point of the liver. Cools off fire in the liver or inflammation. Or the stomach acupuncture point. There. So by controlling these things, we control the organ system. Perhaps you want to control 3 at the same time: kidney or our adrenal gland function, liver and pancreas. You can do it with 1 point right there. Maybe you want to control some local problems. You'll use what is called the eye points of the knee here. As you can see, the insertion does not need to be very deep to trigger a response in the body that goes into the central nervous system and comes back to influence the knee. The idea is to reduce the pain so it quits contracting the blood vessels so that the necessary chemicals can be delivered to the knee that are manufactured in the body, or perhaps the person is on some anti-inflammatory medication. But then these can be delivered to the knee to help the knee reduce its inflammation and tissue destruction. Next, we want to show how osteopathic manipulative medicine can be coupled with acupuncture to treat arthritis of the knee. By controlling the structures from here, we can control the structures that incorporate the acupuncture meridians there. So here, I'm controlling this malleolus, it's a bone, and with my fingers, another malleolus, another bone, to control the sides of the leg. And with my palm, I'm controlling the heel, which controls the midline portion in the back of the leg. Slipping a hand beneath the calf, up under the knee, I can control the local structures of the knee from behind. As we do this, we want to feel a point of balance between our 2 hands within the anatomy. When we achieve this, then the blood flow to the knee, delivering elements within the bloodstream to reduce inflammation and to reduce pain, occurs, improving the arthritic state. So the important thing about this is that we're combining different modalities to treat your arthritis, but I want you to understand that they're based in the organ systems of the body. So if you have something wrong with your blood sugar metabolism, it's going to manifest in that spleen or pancreatic meridian. Or maybe you had hepatitis in the past and it'll manifest in the liver. Or some sort of gastritis is very common to produce problems in the knees, so something from the stomach. And if there is a disturbance in your fat metabolism or a gallbladder dysfunction, it can cause problems around the knee too. So we're not just looking at the knee. We're looking at internal medicine problems inside affecting the organ systems. There's lots of different ways to control this. Your lifestyle, through the diet, we can do external things like acupuncture or manipulation to affect the organs, and we can use homeopathic drugs to pierce the center of the case to balance the body and bring it back to an organ function that is much more normal for that knee. But you have to think beyond the arthritic point in the body to capture all the elements that could be causing arthritis. You can't just limit yourself. And you have to take into account all the drugs that people take. Normal drugs for arthritis can cause problems in the stomach or in the liver. Hypertensive drugs can cause problems in the liver. The list is very, very long. So you have to think about all of those things when you're treating arthritis. The arthritis is an external manifestation of what's going on inside the body. That's the point. If I can help you in any way, please call me at 312-782-9153, or you can contact me through my website.